It is Medical Monday, and today we will be talking about ways to prepare for pregnancy. Now on 3, we are joined by Dr. Catherine Bryant with Augusta Health. Thank you so much for your time today, Dr. Bryant.
Thank you for having me.
All right, so women will obviously have different visits throughout their different stages of that pregnancy. So can you lay out for us now what they can expect at each of those visits?
Absolutely. So, at the first visit in the first trimester, we usually do what we call a pregnancy confirmation. We usually do an ultrasound to confirm dates and, of course, to look at the number of babies there as well. You'll meet a provider and you'll be given basic information on pregnancy, things like safe medications and important diet instructions. At some point in the first trimester, you usually have a physical exam with a pap smear if indicated. Also, we do routine lab work during pregnancy. We check blood counts, we check a blood type, we check a rubella and a chickenpox status, we check for sexually transmitted infections. There is also additional testing that can be done depending on your health status and if you wanted to do any sort of genetic testing. In the first trimester, we usually like to see people around 8 weeks, as long as they're not having any complications. Certainly, if a patient is having problems, we would see them a little bit sooner. Routine topics that we discuss at your first trimester visit include exercise. A lot of patients have questions on what they can do and can't do. I usually tell patients that what they've been doing is probably fine to continue. I don't recommend starting a big new exercise program, but staying active is certainly important. As far as diet, I want to reference the CDC's website. They have a great pregnancy website. It's cdc.gov/pregnancy. They have all sorts of good information on there. We would recommend to your prenatal vitamin. And of course, it's actually important to be on that before you ever try to get pregnant. We know that folic acid can decrease risk of birth defects. I usually remind patients that they should practice healthy behaviors. They should wear their seatbelt. They should stay active. They should eat a healthy diet. Also, I recommend avoiding substances during pregnancy. We know that tobacco and alcohol and other drugs can have effects on baby. It can lead to lower birth weight. It can lead to preterm delivery. Substances can also increase risk of SIDS or sudden infant death syndrome. Also, there's some evidence that developmental delays go along with substance use. So that's an important part of our first trimester visit. As far as during the second trimester, that usually starts after about 14 weeks, and we see you about every 4 weeks during that time. At each visit, you can expect to have your weight checked, expect a blood pressure check, and expect to hear your baby's heartbeat with a Doppler. We offer an AFP test, which screens for spina bifida around 16 to 18 weeks. The fun part that patients look forward to during pregnancy is often their anatomy scan. At that visit, we look at baby's heart and face and brain and stomach and limbs and all the important parts. A lot of times patients choose to find out what they're having at that visit too, as far as a boy or a girl. That of course is fun planning. And of course, some patients decide to leave it as a surprise. We also recommend a diabetes screen between 24 and 28 weeks. For all patients. In the third trimester, which starts at 28 weeks, you would have a visit about every 2 weeks up until 36 weeks, and then go to a visit once a week. We recommend that patients think about childbirth classes at that point. Think about a birth plan. We actually give you a written form to fill out if there are key issues that we need to hear about on your birth plan. And we encourage breastfeeding. So we'll help you get a breast pump. We'll put you in touch with lactation consultants. And we want to make sure that you have a car seat. So that's kind of the basics of what to expect with your visits.
All right, and I know we were talking a little bit before the interview about some vaccines that are recommended for pregnant women out there. Can you lay out what those are for us now?
Absolutely. And I'll again direct you to the cdc.gov website. They have a great website. ACOG.org also has a good website, and the Virginia Department of Health has a good website about vaccines. But I would recommend a flu shot. That is important for everybody. preferably in September or October. However, we're still giving them now if people haven't gotten them. We would recommend that you stay updated with your COVID vaccine. That can be given during pregnancy, and pregnancy is not at all a contraindication to get your COVID vaccine. We also recommend a Tdap shot. That's tetanus, diphtheria, and pertussis. That's given in the 3rd trimester. That helps protect babies from pertussis, which is whooping cough. And we recommend that for all pregnant people, every pregnancy. And then also new this year is the RSV vaccine. This was just approved this fall. It is recommended for pregnant moms between 32 and 36 weeks who are going to be delivering during RSV season. And that protects your baby for the first 6 months of baby's life. And this is a big game changer for babies being born during RSV season.
All right, and I know we also talked about a new nurse navigator that you all have for those high-risk pregnancies. So can you tell us a little bit about that team member and what she can help those pregnant women with on those visits?
Absolutely. I'd love to give a shout out to Roxanne Harris. She is a fabulous resource for moms in our community. She officially is our maternal health nurse navigator, and she can help with anybody who has a pregnancy complication as far as high-risk problems, birth defects, high-risk social situations. She also has some great resources for patients who are suffering from food insecurity or housing insecurity, or who just need a little bit of extra help during the pregnancy or finding baby supplies for their baby.
All right, and say if there's a pregnant woman out there, maybe she sees this segment and she has more questions from you all at Augusta Health, is there a specific way they should go about contacting you all?
Absolutely. We are now pleased to be part of the Augusta Medical Group practice, and I practice in Fishersville at Augusta Health OBGYN Fishersville. Our number is 540-213-7750. We are located just across from the hospital at Beam Lane. Additionally, I have in my office Dr. Keats, Dr. Sims, Dr. Larson, and Dr. Deaton practicing here. We also have certified nurse midwife services through our office, and we are partners with Augusta Health OBGYN Harrisonburg now. They are located in Harrisonburg, obviously, at 240 Lucy Lane, and their number is 540-438-1314. Practicing in that office are Drs. Visker, Dr. Greer, and Dr. Nelson, and they also have certified nurse midwives there. Kara Payne is there, Nicole Coiner is there, and Bobby Gray are there. So we're excited to be part of the Augusta Medical Group family now.
All right, thank you so much for your time today, Dr. Bryant, and thank you for all these helpful tips for those expecting women out there.
Excellent. Thank you again for inviting me.